Hello again, everyone. In this part 2, Dr. Malley touches upon the symptoms of COVID-19 in kids and the management, the danger signs to look out for, and the stages of treatment during hospital admission. We will also be discussing about children with underlying medical conditions and what precautions they need to take. All right. So coming to the next question, we'll come to the next sequence of questions will be about symptoms. So when can I suspect that my child is suffering from COVID? And just an addition to that, how do the symptoms sort of vary between, children less than 2 years and above 2 years, etc.?
Good. Again, it is the children are a little different than adults. That's why it gets a little challenging. And as I just mentioned, a newborn is so different than a 6-month-old, who's so different than a year, who's so different than 12 and 21. So that's why it gets a little challenging. Now, overall, again, the viewers who are listening to this conversation I'm having with Dr. Adapa, you would have already read in the news that children are less susceptible to COVID infections. The chances of them getting infection is less when compared to the adults. That's number one. Even if they get infections, the seriousness of infection is much less, and the mortality or deaths due to COVID is less when compared to the adult population. So that's a very generic observation we have so far with all the reported cases across the world. The second point to know that is a good proportion of the infected pediatric population are asymptomatic. So they wouldn't have any infections. So that's one of the reasons why even today, with all the research that's going on across the world, we do not know the exact percentage of what percentage of children get infected, because many of them are asymptomatic and we don't do screening COVID tests on them. So that is the second piece you have to always think about. They can be totally asymptomatic. Now, the ones who are symptomatic, right? The expression of the disease, again, depends upon, as you rightly mentioned, Dr. Adapa, one is the age, one is the underlying conditions, medical conditions that any kid can have, right? So the most commonest symptom usually that we see is obviously fever, cough, they can have diarrhea, they can have running nose, just like any other cold that a kid have, right? They can have loss of sensations. They can have loss of smell. And as we see is, if they're less than a year, they wouldn't say, Mom, I have loss of smell, right? I have loss of taste. The symptoms would be is they'd be fussy in eating. You can see a child, 8 months, who otherwise is a regular happy feeder, is now restless and doesn't want to eat. There's a loss of appetite, right? That would be the first sign, especially in this environment, that is it something else or is it early symptoms of COVID? That's number one. Now, coming to ages, let's say older kids of 8 to 12 years, if you will, again, fever, cough will be more predominant. Along with they can have diarrhea, vomiting, which is a little lower down in the list. They can also have loss of smell and loss of taste, which is also in a pretty common during that age. The most important thing for parents to understand is obviously, you'll be consulting your local pediatrician when you suspect and maybe you're tested and they're already positive and the symptoms are mild, and the advice is take care at home with all instructions of a diet, hydrations, rest, sleep, which is so important.
Right.
The most important thing for the parent is when is it a red flag for the parents thinking that the disease is progressing a little, there is a little bit of concern, maybe I should take my child to the pediatrician for further checkup and for further recommendations.
Yeah.
First thing, and that's why I kind of told you, is it's always nice to be smarter than the virus, because this is a smart virus. Right. So the only virus is not going to go away. It's a bad news I'm saying. It's not going to go away. It will still stay in the population, but at a different level of severity, just like a common cold. Did the common cold go away? No, it's not going to go away, right? And that is our eventual hope. That's what's going to happen.
Yeah.
Spanish flu, way back in early 90s, was a common cold, right? H1 influenza that we see now was a pandemic way back. What happened? We had herd immunity. Right now, it's a common cold, right? So that is our hope that's going to happen to this particular COVID over a period of time.
Right.
So the most important thing for parent, again, is to understand the disease and how it works. So as I said, the normal understanding is 2 to 14 days, peaks around 6 days, right? So if you have the symptoms, now we are 4, 5 days, 6 days and more, and the severity of the symptoms is same or increasing, that's number one. There is new onset of symptoms, such as the severity of cough is increasing, and there is slight shortness of breath, right? How would a parent recognize shortness of breath, right? If it is less than 2 years, shortness of breath is usually seen when any individual is challenged by exercise. Less than a year, the infants are challenged when they are feeding, when they're feeding a bottle, when they are breastfeeding, because that is how they, that's a cardiorespiratory exercise for them. Yeah. And now they're trying to suck on the bottle, maybe 6-month-old, if you will. They can take 1, 2, 3, 4, or 5 sucks, and then they have to stop. They have to take a breath and go back again, right? So that is shortness of breath in infant less than a year of age. Maybe 2 to 10 years of age. You're talking to them, right? The child can talk in sentences, but can talk 1 or 2 sentences and has to pause, right? Yeah. That's shortness of breath, right? And obviously the severe one is they can't even walk on the own. They can take a few steps or run a little and then they have to sit down, right? Or the cough persistent. So shortness of breath, now there's a change in severity of symptoms. Any other new onset of symptoms such as rash in your body, that is with COVID is one of the signs that something else is happening, meaning it's called as a cytokine storm, but for the parents, it is just that the severity of your immune response to the virus is accelerating right now, okay? Right. And it is causing a little bit of damage to your body. So if there's a rash, shortness of breath, swelling of your hands, a little bit in the morning, you see a 4-year-old has got a little puffy face, any of these are early signs that the severity may be increasing, needs immediate medical attention. So in summary, mostly asymptomatic. Majority of them will have symptoms just like a common cold, which every parent knows. The most important thing for you to recognize is what is normal and what is abnormal symptoms. One is a duration, 6 days, 7 days, new symptoms, shortness of breath, swelling of the feet, rashes, and any child with pre-existing conditions like asthma, diabetes, even should get medical attention earlier than later.
Yeah, those are really good points, Dr. Mally. But I guess I think more concerning for the parents would be, children get running nose and fever all the time. So, whenever a child gets any sort of small sniffles, some parents would hit the panic button, thinking all the time, would this be COVID? So there's no possible way to differentiate COVID symptoms from the normal flu or the cold, which the child always gets, is there?
That is a great question, but unfortunately there is not.
No.
And because this is another common cold, right? Like H influenza virus. So the initial challenge would be is kids can get cough and cold. That is pretty common. 2 to 3 times a year is a normal evolution of the disease. But there is no any specific clinical symptoms that's going to differentiate COVID from other pre-existing common cold. It does not exist. So that is why we have to be, in this environment, we have to be a little cautious. And you have to, unfortunately, in your back of your mind, approach everything as, is this possible COVID? Not to panic, but taking the basic precautions.
Right.
And wearing a mask, keeping that small toddler away from the grandparent. These are the things. And then just consulting the doctor.
Right.
So I think that would be the best approach.
Right. Okay. Great. So, you know, if a parent finds out, like you already mentioned before, they find out that the child is COVID positive. So what are the first things they need to do for the next few days? Just basic management at home. What are the things they need to focus on for the child?
So again, it depends on the age of the child overall. Yeah. But the key things is that it is, as soon as you know the baby's COVID positive, the first thing is try to contain the infections in your home environment. That's the most important thing. And we tend to forget that sometimes. Right. And I always say is be smart, have a plan, always have a plan, have a goal, so right? That will make it easier. So this is a family approach and everybody should be on the same page. Don't panic. I think using common sense and logic, we can overcome this. So the first thing first is, my child is COVID positive. Who else is at high risk at home? You can have an older sibling with diabetes. Please try to keep this, at least for this 10 days, away from this younger sibling. I know they love the younger sibling, but you have to understand and explain to them. Keep the older kid with underlying medical condition away from the sibling who has COVID. Make sure the grandparent who's always hugging and, flattering this child, grandkid, for those 2 weeks. Try to keep it away. That's the first thing. Again, the containment is the most important thing, and try to make the child as comfortable as possible in an area at home that works for the family. The second most important thing is nutrition and food and hydration, right? And keep an eye on that, because the 4 to 5 days during the initial viremia, when the virus is rapidly multiplying and your body is responding to take care of the infection by creating antibodies, there's a lot of stress in your system, right? So your body should be well hydrated, right? The body should get the nutrition so that they can withstand the stress during that 4 to 5 days. So good nutrition as much as possible, good hydration, again, having this fresh air, ventilations, all that is super important. The other important thing is these are all very symptomatic things, symptomatic approach, right? Yes. Giving medications for fever, humidifier if you can have in the bedroom that can help in to decongest some of these secretions for the small child. Yeah. And try to put a mask and hand washing, and these are the preventative measures. So I think is common basic approach during the initial phase is just, there is no other specific medications. It is just ones that you give for symptoms, cough and cold, for any flu. Most important is hydration, nutrition, trying to isolate the child as much as possible, and looking for symptoms which triggers an escalation of care, which I mentioned previously, would be the best initial approach.
Right. So that's excellent. I think you answered my next few questions. Like for adults, we have this regime of drugs, we have antibiotics, we have antivirals, etc. So I guess in the pediatric age group, especially the younger kids, there's not much role for any particular drugs or any regime of drugs, etc. Or is there any role for steroids in young kids? There's a big role.
Right. So we are talking about two things here. One is household management of a child with COVID. That's number one. The second scenario is, as we said, is if there's escalation of symptoms and now is getting more sicker, which is not common at all. I don't want to panic the parents, but God forbid that happens.
Yeah.
And we have this patient in the hospital.
Hospital,
right?
yeah.
Now we go through the list that you went through. But overall, without going into the details, the generic understanding is many of these medications have not been trialed in the pediatric populations.
Right.
Now,
Right.
still use it when the patients are sick, we do. And the generic, very generic approach is, number one, is give all supportive care. That is, if he needs assisted ventilation based on oxygen saturations, based on the oxygen that you're giving and the work of breathing and blood gas and all that stuff, we put them on a ventilator or high flow cannula or a CPAP, all those respiratory measures. Second piece, nutrition. That is super important, as I said, is nutrition, because at the end of the day, you have to build their nutrition, keep it going, because the body is consuming a lot of energy, a lot of key ingredients to produce those antibodies to kill the virus, right? So it's a battle between the virus and your immunity.
Right.
And bodies, we want the immunity to win. We don't want the immunity to lose, because then the virus gets an upper hand. So that is why even at home, when I said nutrition, food, hydration, that is why I'm saying, because once your immunity in the body starts to crumble, then the virus starts multiplying. And those are the very simple things why they get infected. And quickly is, even in the hospitals, if they get sicker, the first line obviously is use a drug that's going to prevent or slow down viral multiplication, right? The remdesivir is one of the stuff that we use. Second stage, we do that. And it's approved above 12 years of age, but hey, even if it is 6 years, if the kids are sick, they've used it. The second line always is, can I boost the child's immunity, right? Artificially. That's when you have monoclonal antibodies, you can get plasmapheresis, very rarely in pediatrics, but very sick has been done.
All right.
Third approach obviously is, okay, I've done everything. Now, can I artificially try to decrease the inflammation in the body? That's when you give steroids, right? Okay. It's a combination of all these three. And the last piece, which in the adult medicine they use, is we call that as the cytokine storm, meaning your body overreacts to the virus and then uses a tremendous amount of antibodies, which you don't need so much, right? So there are, tons of antibodies that are produced for a small group of virus, right? A portion of the antibodies will kill the virus. Yeah. The rest of those will kill your own body or attack your own body tissues. And that's called as a cytokine storm. And in children, it is called as multi-system inflammatory syndrome in children, called as MISC, which we saw in New York during the second wave. And those are the patients, some of those patients have received the regime that I've just told you. Immunoglobulins, plasmapheresis, remdesivir, and also to kind of neutralize the effects of the cytokines, the body's own antibodies. They've used some drugs to antagonize actions of the cytokine IL-1, IL-6. So it is used for trials, more of a last-ditch effort for the very small pediatric population who are very sick and needs ICU care. The only drug that is approved by the FDA in US is remdesivir, but for patients who are about 12 years of age.
Okay. Thank you for that really good explanation. So my next questions would be, there are certain, like you already mentioned, there are certain kids who are slightly more prone for, say, more severe infections. say kids who have asthma, like you said, so diabetes, especially asthma, there's a lot of kids in India who have asthma, so they will be on inhalers or steroids. So during the pandemic, can they continue taking steroids when they're at home?
Great question. And one of the things in pediatrics, right, and I probably have failed to mention in my earlier conversation, is one of the things we are seeing is the direct effect of COVID infections in pediatric population. That's one.
Yeah.
What is untapped and not quantified or not known is pediatric population with underlying diseases and they're failing to get medical attention or going to the doctors, right? Because so much focus on COVID, there is a lockdown, you're not going to a pediatrician, you're not getting your shots, immunizations, you're not going and getting your regular treatment for diabetes, you're not failing to get checked up and the annual checkup and the treatment regime for asthma, right? And that actually is causing a lot of problem. And probably we'll talk a little bit later on the third wave.
Right.
And that is an issue. And as a trained pediatrician, my personal opinion and advice is continue to take care of the normal approaches that you're taking care of your child has to be taken care of. The normal well baby visits, the normal immunizations, and specific treatment for specific underlying conditions has to be taken care of.
Right.
Because what happens is if you're not taking care of underlying conditions and not getting your well baby checkups, right? As I told you, it's a battle between the virus and a battle between the immunity. Who's going to win?
Right.
So you have to make sure the basic immunity, basic care, and the basic underlying disease conditions that one has to be taken care of. So that is my generic advice for any diseases. Could it be asthma? Could it be diabetes? It's the same, because if a patient is on inhaled steroids for asthma, the asthma is going to get worse.
Correct.
And that's a perfect setting. God forbid if that patient gets COVID, the COVID is going to really be a little on the severe side, because you know how the lungs are going to react to the virus when he already has a severe underlying severe asthma.
Right. Okay. So that's a good point. So continue, taking care of your children as how you were doing before the pandemic. And so when it comes to immunization schedules, make sure your child is getting the regular immunization as per the schedule, etc. Is that what you would advise parents?
Absolutely. Yeah. That is my advice as a pediatrician to all the parents who are listening to this is do not neglect the normal well baby visits, well baby care that your child is supposed to take on a regular basis.
All right. In the next video, which is the final part of the series, Dr. Mally touches upon the mother's point of view. Can a pregnant woman transmit the virus to the fetus? Can a lactating mother transmit the virus via the breast milk? And what precautions should a COVID positive mother take during breastfeeding? We'll also be discussing about vaccinations for lactating and pregnant women and children. And in conclusion, Dr. Mally will also be talking about the third wave and how will this differ from the earlier waves, and will this wave hit kids harder? We'll also be discussing of how best we can prepare for the so-called third wave. Do like and subscribe to my channel so that you can be notified in the future whenever I put up more relevant content. Thank you and stay safe.